and welcome. I'm Dr. Himadri. I'm a public health expert and passionate about the national health policy. And today I have the wonderful opportunity to interact with the country's leading policymaker, Professor Rajendra Pratap Gupta. Welcome, sir. Professor Rajendra Pratap Gupta is a leading policy expert with vast experience in policy making. He has been involved in major global initiatives. He is the former advisor to the Union Health Minister, Government of India, and played a key role in drafting of the National Health Policy, National Education Policy 2020, and the BJP Manifesto in 2009 and 2014. And also, he has drafted policies for labours. He was nominated by the World Economic Forum on the Global Agenda Council and recognized for his global contributions to healthcare by Sheriff of Los Angeles. He was conferred the Global Impact Award by the Personal Connected Health Alliance, a HIMSS organization at Boston, and his contributions and careers have been chronicled as a case study in the global health by the Royal Society of Tropical Medicine and Health for their Grow Global initiative. He is a member of the Guidelines Development Group at WHO, global roster of experts in digital health, and chairman of 2 dynamic coalitions at IGF United Nations. He is also the author of 5 books, which have been the source of major policy ideas and initiatives. So today, let's learn from him on the drafting of national health policy in the current context and what's the message for people who want to pursue a career in policy making. Over to you, sir.
Thanks for having me, Himadri. And you can shoot your questions.
Sir, you had the rare distinction to draft policies for all sectors. So what priority do you assign to health as a policymaker?
If without health, there is no education, and without education, there is no development. And I'll tell you this because if people are not healthy, will they study? If they will not study, will they plan or work? So I think health to me appears to be the foundation for making a country developed. And this is the primary building block. So that's a very high priority I give to health when it comes to national policies.
So my next question was, what was your vision for National Health Policy 2017?
So it was way back in 2000, I think 12 or 13 when I approached the health secretary, and he was a great guy. Unfortunately, he's no more, Mr. Keshav Raju. So I asked him that 12th 5-year plan has a major outlay towards health. So why don't we have a health policy? It's just adhocism, if you don't have a health policy and you have such a major outlay towards health. And he confessed, sir, look, it requires heavy lifting. I think none of the people in the health ministry would do that. So my time came in 2013 around July, August, when, the work on election manifesto of BJP started. Then I realized it would be great to have our vision put as, in the manifesto, which will eventually translate into the, plan for health. So the first line I put on the health section was that it's time to have a comprehensive health policy. And the vision was very clear, which was like one line, which is increasing access, improving quality, lowering the cost. And this is a line I translated in the health policy as well. This is like assuring health to all Indians with the objective of lowering the out-of-pocket expenses. And the best part of that was that address all 3 issues: governance, financing, and delivery of healthcare. That's it.
So also, what are the points in the National Health Policy 2017 that make it unique?
Interesting. So the health policy is disruptive in many ways. One is it has a clear vision. If you really look at the health policy, it comes with a very clear vision, quantifiable goal, which was never, I guess, in the previous policies. So I believe that goals should be qualified, which should tell people that by this year we'll achieve this. So health policy, if you look at in the initial pages, there are quantifiable goals. It de-siloed the way we look at health policy. It talks about pollution, which is Ministry of Environment. It talks about Swachh Bharat, which is a different ministry. It talks about clean, potable drinking water. So we realized, that health policy should have covered all the things that matter. So it has covered that, which is de-siloing, policy making in health. It talks about health impact assessment. So everything which is a policy initiative program that we mentioned in the health policy will have health impact assessment. So actually, if you ask me, there's nothing cast in stone. Given that, in our country, we had policies first after 36, 37 years, then after 20 years, and then after 17, 14 years. So if that's the case, then we should not cast them in stone. I don't know when the next policy will come or if it will come. So there will be health impact assessment. So that's a very important thing. Talked about preemptive healthcare. I'm very passionate about. I'm champion of preemptive healthcare model. So it lays focus on school health for children. You need to preempt the occurrence of diseases. It talks about strategic purchasing. Now, this is something that people will normally assume that we are out there to sell healthcare to private sector. Actually, it is not. If you carefully read the line, it says strategic purchasing to meet the shortfall of what's not available as a short-term measure, but long-term will upgrade the public health infrastructure, and the focus will remain public health infrastructure. I think that's one of the big things. Excess capacity in healthcare has been talked about. So just think, if we do that, if again COVID strikes or something like that strikes, we'll have enough capacity to meet the needs of that disaster or the emergent needs. And if you look at the quality in healthcare, so it's again something that people have to study policy to get those recommendations. It talks about setting up a national health standards organization. If you couple that with what's written on page 23, that says that we'll have a mandatory disclosure of treatment and success rates across private and public health facilities, which effectively means doing away with NABH, creating something really disruptive where you actually measure quality rather than just giving the logo based accreditation that you're this certified and that certified. I think that was pretty disruptive. It also talks about giving back to society initiative. So a lot of people used to write to me that we have made our name, career and money in health, and we work in this part of the world. Can we do something for our country? So I created this giving back to society initiative, which is rarely that you find in a policy. So then the digital health. So that was another interesting part, where when I breached this topic with the people who were, tasked to kind of pen it down sitting with me, I said, we need to put digital health in detail. They said, let's put IEC. I said, no, that's pretty vague. So I ended up putting digital health as ecosystem, qualifying what is wearables, cloud. So it has gone in detail on the digital health ecosystem. And if you really look at important recommendations and people like you who are in public health, so it says that people in public health should hold senior public health positions, which is typically done by administrators. So we actually ended up addressing all those nitty-gritties there. And of course, the community-based monitoring and planning, something that we need. I mean, don't expect government to be a payer, provider, and also, what you call a regulator. It's actually a conflict of interest. So this was put in community-based monitoring and planning. And the last part, like all policies are like a piece of paper, that's what people say. So this is the implementation framework. So I think if you really look at policy, it's pretty disruptive in its approach. And that's what I think are very unique salient points that people should understand about the national policy.
Wonderful, sir. So next, I would like to know any experience that you would like to share with us you had, while giving a final shape to the National Health Policy 2017.
Absolutely. So the first thing, I should thank the Honorable Health Minister who gave a free hand. When the policy document came to me, there was a free hand to do what was needed. And the other best part is the government approved, the cabinet and the government approved without any modification, which is again a big thing. But if we look at, very few people know that there is a situational analysis of the national health policy. So I split that into two documents. So there is a situational analysis and there is the national health policy. It becomes effectively a 36-page, I think, kind of A5 size document, which is pretty small. Then, the way I draft policies, I had my own checklist. I had, I think, a 150 item checklist with me. So what I did was that when I sat with the team, I said, look, I need to see that these things are in the policy. So I ended up putting that in the policy, and effectively what happened is that all the things that needed to be there were put in there. So if you look at how do we promote family medicine, so that was put in there. SDGs, for which India is a signatory, was not there in the policy document. Same way, I mean, Mission Indradhanush, one of the most successful programs of the government, was not at all in the policy. So this was actually put in. Then also orphan drugs, something that we need to be careful about, the diseases that we don't focus on, but still population has them. And then we have the preemptive care, which obviously is something that I was championing, and digital health was put in detail, which was a big, I think I would say, discussion, how to and why do we put it. Lastly, implementation framework. So I think these were the experiences that come because one was prepared that if suddenly you are asked to say that on one side, I have been activist all my life, I'm asked to say, hey, look, the health policy is stuck. We need to get it out. We need to get it done. So can you vet it, make it in a shape and form that gets it out? So my job here was to make sure that the people who lobby with vested interest don't find their inputs in it, but it is actually meant for the end user, with public or population at the center. I mean, my goal was to see that do we really go ahead to achieve the three goals we outlined when I wrote the manifesto is that increasing access, improving quality, and lowering the cost. So I think it was easy when I look at the document that has come out, but there was a whole lot of preparedness that went into to make it in the form that is today as national health policy.
Thank you, sir. And sir, any reflections on national health policy in 2022, as it's been already 5 years since it came?
Yeah, COVID has done one thing. It's shaken the world. If you really look at it, there's nothing that remains the same. So it didn't change one country, one sector. It actually shook the world. So and I would say a thing like this happened, which is once in a century or probably two, the entire fundamentals get shaken up. So I think I would go back and revisit some of the aspects of the national health policy. I think we need transformational change. So I'm planning to do that. So I set up Health Parliament during COVID and the Public Task Force for Accountable Healthcare. And this is lined with, the health policies recommendation also, that we need community-based planning and monitoring. And that's where we're trying to see what are the transformational gaps in healthcare and what we need to do. So we're working with various public health passionate professionals to see how we can do that. But I think it's time to revisit and reimagine health.
So coming to the last section of this session. So your message for people planning a career in public policy, budding policy makers or planners or researchers, what would that be?
Thanks, Imaji. So I get a lot of emails on my LinkedIn, that I've done masters in public policy or public health from this. How can I contribute to health policy? To them, I have a short message. So public policy is not about reading. It's about seeing and doing. So you need to be in the trenches. So that's the message. And we will launch a course in public health towards next year, maybe second half, where we want to create public health professionals across private and public sectors. So that's something we're going to do. And I think public health professionals should spend more time in the field trying to understand the issues and work for them. So then they should actually become an effective public health professional. So that's where we're trying to do at Health Parliament and the academy we have launched.
Thank you so much, sir, for this insightful session. And I'm sure this will inspire a lot of aspiring policymakers. Thank you once again.
Thank you so much, Matthew, for having me.